In today's video, we are going to talk about that topic that gives so many women concern. That is the issue of delivery. Delivery per vaginum and delivery per cesarean section. Both of them are wonderful, depending on the health, on your health status. What do we mean by delivery per vaginum? That is the delivery without medical intervention. The woman is allowed to deliver by herself without any incision being made. And that depends on her state of health. While that of cesarean section is whereby an incision is made by the surgeon in order to bring out the baby successfully, her abdomen. So we are going to discuss about the benefits of each of them and the challenges. When it comes to vaginal delivery, one of the benefits is there's quick recovery by the mother. That skin-to-skin contact immediately after delivery is there, and there is low risk of infection, especially whereby the system, that is the checking of the cervical dilatation, they use proper methods, so there is low risk of infection. And also the woman has that option of having a quick local discharge, or what we call quick involution. So these are some of the benefits, and there is equally less problem on the baby's breathing, because immediately the baby labored and comes out, that quick cry, and you see that the oxygen, the air gets into the lungs and the baby cries out easily. Then that of cesarean section, some benefit, okay, the delivery per vaginum, as I earlier mentioned, there are still some challenges. The women at times, they have tear up to the cervix, and that may cause bleeding, because in most cases when there is tear in the cervix, to detect it is always a problem. So there may be tear that the woman may bleed to death if not well taken care of. So usually that is the major problem, and at times there is prolonged labor that may take the woman's life if quick medical intervention is not being sought. And equally, the baby may have what we call fetal distress because of the prolonged labor. That is that. When we talk about cesarean section, incision is being made, so at the end, the woman will suffer that long period of recovery. Some of them that are not all that agile, to get up the next day after 24 hours is a problem, and they have also delayed skin-to-skin contact because they are just there trying to recover pains and all that they pass through. So in most cases, they equally have issues of wound breakdown. So to mention just a few, in order not to to scare some people, that when the option comes to cesarean section, they say, no, there's big problem. So on both of them, there is risk or there is problem. And in the cesarean section, there's risk of infection, just like I said, which may cause wound breakdown. But why making these two choices? Every woman wants to deliver per vaginum, but peradventure there is an issue that may lead the doctor, or that may warrant the doctor telling you that, oh woman, it seems you are going to deliver by cesarean section. When there is multiple pregnancies, some people carry 4, some carry more than that. So you cannot keep pushing out one by one. That would be quite, terrible on the woman. You push out, and you are crying on each of them. Some is malposition. Some women that are very short and their husband is big, so the woman's pelvic may not carry such baby out. There are some people that have disease conditions, some people that are diabetic. Their situation need to reach, they will not be allowed to do it by themselves. Eclampsia, when a woman is laboring and it happens to fit, the easiest way is to do surgery. So surgery is the best option for some complicated cases, instead of allowing the woman to die or the baby to die. So the quick intervention is CS. So we cannot say vaginum is the best, cesarean section is the best. Each pregnancy is unique. You may have vaginal delivery, the first one, but the second one is another story. It may be placenta previa. So each pregnancy is unique. And the way to deliver them is when your health status can carry it. So you will not say, I jump and pass. Let me shock you. There's a friend that say doesn't want to do CS, but finally she delivered that baby, and she bled to the extent that they have to open her up to hold the uterus, and that was not possible until the uterus was removed, and finally she died. So every woman shouldn't be so scared that having CS is a bad thing. These days, most women, they opt for it. So think of it. Is it your health that is more important to you, or that you want to deliver a vaginal? So I wouldn't want you to have that thought. The safest method is that method that you had, and at last you are dancing to the glory of God. You are there, your baby is there. So I don't know your thoughts concerning this video. If you find it so helpful, I want you to subscribe if you have not done so. Then you share the video for those people you know that may need it. Thanks for watching.